welcome everyone. My name is Chastity Weiner. I am the director for the OPAL Senior Center, and we have with us Janelle McQueen from the Baltimore County Fire Department. If you've ever been in a situation where you had to call 911, it feels like there's so many things going on, and you're trying to be attentive and you're trying to, just get them there quickly, even though you can't control them getting there. They're doing their own thing in the background. And here with us, we have Janelle, who kind of will take us step by step on some helpful tips when we find ourselves calling 911, and then maybe what happens on the background, so that way we could be assured that they are doing due diligence in the meantime of getting to us. So, Janelle, welcome to Opal.
Thank you. Thank you for having me. Yes, this is a really good topic, and I actually like doing topics like this. But the one thing I want to start off with, a lot of people think that when they call 911 and they're being asked like a million questions, just rest assured that even though they're still on the phone asking questions, they have already dispatched someone to you. And I am a paramedic that works in the field, so I am responding to these calls. And sometimes when you guys are still on the phone answering the questions, they're updating us. They'll say, this is more information that we have received, or they'll say, updated information is this according to the way you're answering the questions. So do not think that if they're asking a bunch of questions, no one's en route. We are en route. They're just getting additional information to help us out. That's all. So I wanted to start off with that. Did I lose you?
No, we're here.
Oh, okay. So I do have a PowerPoint that I wanted to go over, and it's calling 911. What to expect from the Baltimore County Fire Department when you call 911. And again, like I said, I just explained the first part that they will ask a lot of questions. They have templates they go through in reference to whatever your chief complaint is, and then they'll ask questions, and like they'll keep us updated. Okay. So Baltimore County service a lot of ground for Baltimore County. It's a large, diverse population. It varies for different from suburban to urban to rural. It's just a lot. So this is how many square miles we have, 598.36. This is how large of an area that we service. And as of last March of 2024, they're saying our population estimate is about 844,700 people. So that's a lot of people we have to service. That's a lot of area to cover, but we find a way to get it done. This is just a little information about our call volume. So this is all based off of 2024's stats. So the police department dispatchers, this is their yearly total. Then you have your fire dispatch yearly totals. Then you have your EMS total dispatches. And with a total of everyone for police, fire, and EMS was over 800,000 calls. So that's a lot of calls to get in 1 year. To
That's
just
like
help you.
that's like one person, one call per person every year. Over
Yes,
one point.
yes. So there are a lot of calls that come out. Like it says, if it's only 844,000 residents and we had 851,000 calls, that's a lot. So, and the thing about it is we do have a lot of frequent callers, and you get to know them, and you in your neighborhood, you get to know them, understand them, and help them out and try to refer them to different resources if need be. But the goal is, of course, to get them transported. So also one thing that we that is available to you guys through the Department of Aging is this orange card. And you all can see this, but on the screen, it's an orange card. They give these out. With this card is you can write down your information. So if you ever have to call 911, we're asking for information. If you have this card filled out and can give this to us, that is a big help. So on here, it has your name, your address, your contact information. It has like your doctor's name. It has your your medical history, if you have any allergies. It also lists your medications that you take every day. And that's a big thing for us because if you take certain medications, maybe you won't qualify for a certain treatment, or we have to treat something a little differently. A lot of times when you're in need for help, you may not think about these things right away. But if you can get these cards, have them filled out, and when we come and we ask for this information, you can just hand us the card. And that is a huge help for us to help you. And if you're not able to even say anything to us, if you have that card, we can look on that card and we can call like your contact person and try to get information, try to find out different things. So, but these cards are available to the Department of Aging.
Yeah, and Janelle, just a quick offer since we are recording this. If anyone is watching this and would like me to mail them one, I certainly can. You would just email me at the Opal Center at BaltimoreCountyMD.gov, and I have them in my senior center, and all senior centers have them as well.
Okay. All right. So, a lot of times it says make plans ahead of time. Most time, if you're calling 911, you cannot make plans ahead of time. But if you are able to do these things, if you're, to the point where you can still get things done, just make sure you have everything you need. Some people take their address book. The older generation still uses address books, and they have all their information there for their family, their doctors. If you need glasses, if you use a walker, a lot of times 911 may not take your walkers because, for one, we really don't have anywhere to secure them safely in the medic, but we will find a way if we have to. And then also, when you go to the hospital, when we drop you off, we don't know where they're going to put you, and those things, those items get lost. So we try to, have you figure out if you want to take it, and then you may not come home with it, it may get misplaced. So, and usually if you're on home oxygen, we do have our own oxygen. So if you're all on home oxygen, we will supply you with the oxygen that we have. If you can get someone to bring it to you when you're discharged, something like that, that's fine. If you want to bring it, that's fine too. But just have all your different things. Like a lot of people who have hearing aids, they make sure they have their hearing aids in, because if not, if they get there, they it's hard communicating with them. So just try to plan ahead of time. But again, a lot of people when they call, they don't think about it. But nowadays with the your cellular devices, you may need your chargers, batteries for your hearing aids, just all of that, to try to keep all that stuff where you can get to it easily. And then as far as shoes, slip-on shoes are fine. You don't have to, make sure you have all that stuff. But sometimes patients do leave home without their shoes. But this is just a list of different things that you could do to for ahead of time. Do you have any questions so far? Okay. All right. So next we're gonna also when in the midst of make plans ahead of time, your house numbers. This is a big thing. Try to have your house numbers visible. So just think, if you call in the middle of the night, we do have lights on the side of the ambulances that we can shine and help us see things more clearly. But if you can have your numbers out and visible, that's good. And sometimes if you can turn a porch light on to help us, open or unlock the doors, that would help us out also to try to get to you easily. Keeping your front free of obstructions. So a lot of times it can be hazards for us. So we will have to call for additional resources to help get patients safely out of the house. But just, remember, if you have any type of illnesses where you may happen to call 911, just try to keep your front clean, free of obstructions, nothing there, so we can get in and get you out easily. And also, we have a non-emergency number with the dispatch center, which is 410-887-2222. You can call them for any non-emergency issues, and they will direct you where you need to go. But of course, if it's an emergency, by all means, please call 911. And like I said before, as far as like planning, but if you call 911, if you are able to, try to unlock your door. Make sure your front light is on. Um, be specific if like where you need us to go. Like some callers may say, um, I leave my back door unlocked, or I leave my back window on the deck unlocked so you can open the door that way. If those are things, if you have put in place because you're unable to come to the door or unable to unlock your door, let us in, you can let us know that. Some people actually have the locks that you usually see, like the padlocks, you can open it, and then inside is the key to the house. A lot of elderly are people who aren't able to answer the door for us. They have those, and they can put those on the doorknob, and you just give the dispatcher whatever the code is. They will not say the code over the air because people can listen into our frequencies, but they will send it to us on our computer, so it is secure, and we can just put the code in, get the key to your door, and go in. So there are a lot of different options you can have, and you can try to prepare yourself for if you ever need to call 911. Also, once you get the call, they will tell you to try to secure your pets. A lot of people really don't understand how important this is, and it's important to do this because your pets are your pets. They don't know us. And even if we come in and we're trying to help you, they may look at us, we're there to harm you, and they can get in the way. It could be the sweetest dog. Oh, he doesn't bite, but the dog does not understand that we're there to help. So the dispatchers will tell you to try to put your pets away, different things like that. Um, if you call 911 and you do not have access or don't have one of those orange cards, they will ask you to gather your medications together in their containers. Again, we need to know what medications you take because, like I said, that will help determine what treatment you can or cannot get. And then also, we also recommend not taking your prescriptions with you. We will write them down, and because again, get them to the hospital, don't know what is going to happen, where it's going to end up, and you may lose them. And then trying to get insurance companies to replace them can be a little difficult. So if it was me and I want to see you give me your medications, I will write down your medications, and then I will say, here you go, leave them here, and then I will pass it on to the hospital. Do we have any questions about that?
No, I think we're a good group that always is happy to interrupt if needed.
Okay, good. Okay. So now here's the thing. Who is coming to help me? So in Baltimore County, we have career personnel and we have volunteer personnel. So the career personnel, of course, are the sworn employees of Baltimore County's fire department. The volunteers, they volunteer their time at a volunteer station. And so you could get either one. You can get a career unit or volunteer unit. We're all trained the same. We do the trainings together. We all work together. The difference is the career is they're always in service. The volunteers could be in service as they week because they don't have the members available to staff their they will do fundraisers or take donations that help keep their department running, their firehouse running. Career, we do not. So that's also the difference between the two. And but like again, we do train together and work together. So, in reference to all the miles that we cover, all the people, we do have this is a list of all of our stations, and altogether, I think it's 66 altogether. But so the ones over here on this side, which that's Towson, these are our career stations. All of these are our career stations. On the other column, this is all of our volunteer stations. Some of our career stations have 2 units that runs out of them, which is ambulances. They have 2 of them. So we have a total, we just had 3 more go in service within the last month. So as of right now, as far as career units, we have 38 of them. The only difference is we do have multiple shifts. So not all 38 are in service at any given time. But Monday through Friday from 7 to 5, you will have, well, I'll say from 9 to 5, you will have all 38 units in service. But if not, you at least have 1 unit from all of these stations in service. And then again, these are our volunteer stations. Again, they are only in service if they have the personnel there to staff. And basically, um, and some of our volunteer stations, they don't have an ambulance to respond. So we have a list here is 5 of them that are only for fire. They don't have medic units. And then also, there's a difference in what type of medic unit you will get. You can get an ALS unit, which stands for Advanced Life Support, or you can get a BLS unit, which is for Basic Life Support. So on a BLS unit, you usually will have 2 EMTs, and the EMTs are considered basic life support. They're still clinicians. They can give some drugs, they can do some things, but the advanced life support unit has a paramedic on it who can do a lot more advanced skills than EMTs. So, so if a crew gets to your residence and they need additional help because maybe you need something they aren't certified to do, they're calling for help to get someone with like a higher level of care. Sometimes most of the time, they can handle the calls on their own. But just so you can understand, you may get an ALS unit, which has a paramedic on it, or you may get a BLS unit with 2 EMTs on it. But they're all clinicians and can still provide the basic life support for you. Oh, it is 66 total units. Okay, we talked about the BLS and the ALS, who's coming to help me. We have that. I explained that. And here's a breakdown again, like for basic life support, they have AED on their units. They can do a 12 lead, which is a picture of your heart. They may not can read it, but they have the capability of transmitting to the hospital and talking to a doctor, and a doctor can say, please transport this patient. They are trained in CPR. They can do things to keep your airway and keep you breathing. They have oxygen. They can control bleedings. They can do splinting. And they also have, they can do IVs. They can do basic medication, things like that. The advanced life support units, they can do the defibrillations, cardioversions, and different. They can also do 12 leads. They can also treat your 12 lead. They can do advanced airways. They can give more medications, give more oxygen, just more invasive procedures can be done with an ALS unit than a BLS unit. So now next topic would be advanced directives. So in the state of Maryland, EMS providers can only use the MOST form, which is the Maryland Medical Orders for Life-Sustaining Treatment. You can get these forms filled out by your primary care, but this is the only form when it comes down to any type of DNR that we can accept. A lot of people have living wills. They may have different things. They have maybe gone to notary and got it notarized, or they just what a DNR form, something they had is in the hospital, things like that. If you have any of that, we can only accept a most form, and it must be signed by your doctor. And on this form, it tells us if you filled it out, if a family fills it out, what you need done. It doesn't show on this PowerPoint that it comes with 2 pages. So the front page is what EMS really, really needs. This is what we look for. The second page is basically for the hospital. So they'll know as far as more invasive things, what you do and do not want. But as far as for EMS, we definitely need this first sheet here. Oh, another thing that we have told patients, if you have this, you can put it in your refrigerator, put it on your refrigerator. So if we come in, we know where it is. I've seen some patients who have honestly had it taped over top of their bed in their bedroom. So all depends where you want it. But it's also a website here, www.marylandmost.org. You can always call that too to get more information, to get the copies. But most primary care physicians have these forms in their office. Okay, so that's that. Now we can talk about who's coming to help me. And a lot of people don't understand sometimes why you'll get a fire engine first, or you'll get just an ambulance, or you'll get both, or you'll get a police. And we also have duty officers, which are supervising paramedics that sometimes may respond to calls. And so the reason you make an ambulance first, I mean a fire engine first, is because maybe you're getting a medic unit that's further away than your closest. Your closest one could be on another call. So you're getting another medic unit that's a little further away. The fire engine can come and they are still trained as EMTs. Sometimes they have paramedics on them. They can still come and start treatment. So when the medic unit gets there, they can just turn over care to the medic unit and they can do the transport. Sometimes the police comes just because to make sure there's no foul play involved, make sure everything's good, or it just could be the safety of the EMS crew. And the supervisor will come for more severe calls. And if it's a BLS unit that needs to be upgraded with a paramedic, they can upgrade them to give you the care you need to the hospital. So if you see a lot of people come in, it's not because of anything like, oh my God, this is not, I didn't need all of this. You're getting these people because of the level of care of the medic unit. They could have been further away. The engine can get there first to help give you treatment sooner. So it's different reasons why, but this is what you may get. Um, the 911 dispatchers, they only dispatch the calls. When going to the hospital, that is up to, of course, the patient and the EMS crew. A lot of people will say, I only can go to this hospital, I only can go to that hospital. Now, with um, hospitals being completely overwhelmed, we are not allowed to just go to any hospital anymore. We have to ask to go or ask to see if those hospitals are open and available to take patients. And also remember, we have to, if you're having cardiac issue and this hospital doesn't have it's not a cardiac center, I'm not going to take you there because they don't have the capacity to take care of you in the level of care that you need. So a lot of that will be um, looked into. So these are the reasons why hospital destinations are determined, because of the patient's needs. If you need a cardiac hospital, I'm going to take you to the cardiac hospital. Try to give an example, Northwest Hospital, that's on the west side of Baltimore County in Randallstown. They do not have any cardiac intervention capabilities there. So if I have a patient that needs a cardiac cath lab or anything cardiac, I will bypass them and take them to Sinai, because why take them to Northwest when I know they don't have what they need for their treatment? And then, of course, the severity of it, like a lot of people may only want to go to St. Joe. They may live on the west side, again, in Randallstown. If you are unstable, I cannot take you to St. Joe. I had to take you to the closest hospital. They can transfer you out later. It's called inter-hospital transfer. but I would have to take you to the closest hospital. Pre-existing conditions being treated at specialty centers. So a lot of times with cancer patients, if they are stable enough and they're being treated at a hospital that's a little further away, I can ask permission to take you there because that's where your treatment is. They know you there. And if that's going to be the best for your a better outcome for you, I would rather take you there. And then also the hospital uh, room status. Some hospitals can say they don't have any more beds. They're completely full. Their waiting room is 12 hours long. They report all of that to a system and we look at that. So we have a hospital that has just say 5 medic units still sitting there with patients on their stretchers and their waiting room is completely packed. They have no beds. We're not going to take another patient there because apparently they're completely overwhelmed. They cannot take it. So, because of the severities of the emergency rooms being full, we now have what we call an MDO, which is a medical duty officer, which is a EMS lieutenant. They sit there and they monitor all of this. So before we go to a hospital, we have to call an MDO and ask, okay, this is what I have. Can I go to this hospital? They'll say yes or no. But if they say no, they give you the reason why and give you other options. We will then discuss it with the patient and then we can go from there. We have a special hospital for hand trauma. We have hyperbaric medicine, pediatrics, obstetrics. We have different specialties for everywhere, and those hospitals are determined by the MEMS Center. So again, we take patients where they're going to get the treatment that they need. We also have a protocol that's fairly new, maybe like 3 to 4 years old. It's called directed triage. These are for patients that have non-life threatening issues that we can take them directly to the waiting room. Their blood pressures have to be good, heart rate, like nothing wrong with that. And we can take them directly. And we will tell patients that it's like, we will take you to the hospital. We have no problem with that. But because of your symptoms and your vital signs and the fact that you are stable, we will take you and put you in the waiting room. So a lot of people have the misconception that if you come by 911, I'm going straight to the back, I'm getting in the bed. No, we can take you to the waiting room and you will wait your turn like everyone else. So that is a thing that MEMS came up with, like I said, maybe 3 to 4 years ago, where we can do this to help with us not waiting at the hospital. We can get back on the streets to help other citizens of Baltimore County. Excuse me. So our MDO, our medical duty officer, is also in the same building as our dispatch center. So they're working side by side with the dispatchers and the call takers to make sure you guys are getting the best care, and you're getting to the hospital, a hospital that can treat whatever your chief complaint is. This is also a program that is fairly new also. This is it replaced an old program. What this program does, it lists all the hospitals that we can go to. It gives us their status. So if they had a 1 or 2, that's okay for us to go to. If it's a 3, we're going to think a little hard on it. If they're a 4, we definitely don't want to go. So the lower the number, the better your chance of getting, they have availability to see you. The higher the number, they're completely overwhelmed and you're going to be waiting for a while. It also tells you how many units are en route to that hospital, how many units are sitting at that hospital. So if you look on this one, let's look at Carroll County Hospital. You see here, they're 1. So which means they're moving patients through. They have beds, they can see patients, but they also have 2 units en route and 4 units there, which I don't understand why there's still a 1, but it's the way it's supposed to be. But the units have been there for 46 minutes. So they have had these units there for 13 to 46 minutes. You see you may have, this one is a 3. They was probably trying to avoid this hospital, but now they have 3 units en route, but they don't have any there waiting. So sometimes you can tell we try to not go there. Also, they have MIMS also have a alert that's bypass, which means if they're on bypass, that means you have to bypass them and go to another hospital. So it's just a lot of different things that goes into it. But this is also that chart I was talking about, the 1, 2, 3, 4. So for one, it's 0 to 75% occupied. This one is, as you can see, up and forth. So you have a hospital that's 131% plus occupied. Do you really want to go to that hospital? Because as you can see, they're completely overwhelmed. So this is what they call the ED indexed, and it just helps us keep track of how busy they are, and you just don't want to keep overwhelming a hospital and just keep taking the patients. They can't take care of the patients they already have. um this is also just different things according with the other program. It just updates. It lets you know you're taking the patient to a hospital. This is just, we can see what Baltimore City Fire Department is doing. We can see what Anne Arundel County, every single jurisdiction in Maryland uses this program to help us understand how many units are there, how long they've been there. And it's, if you already have 4 units there and you see that the city has a medic unit going there and Anne Arundel was going there, you're not going to send another one there to help unless it's a complete have to priority one, they have to go there. But if you can control where they're going, this is what the MDO, the medical duty officer job, is to help us get there. And also, if you have family members, or if you call 911 for one of your family members and you want to follow us, if you can see this picture, this is a big no-no. Please do not follow medic units. If they go through a red light, please do not go through a red light with them. Keep your distance, because when you get there, you're gonna have to go to the waiting room anyway. So it doesn't matter which way. If you're there with us, you're not going in the back with us. So to be on the safe side, please do not follow medic units this close and go through red lights with them. Um, Another thing is going to the hospital. Can you take someone with you? I know during COVID, we had stopped doing that, but now it's also up to the person who wants to go, and to the medic unit crew. So if you have family members that aren't cooperative and we're not going to let them go. Also, if you look at this picture, if you look at the front, that is a huge step up to get inside. If it's a family member that is unable to step up into the medic unit without assistance, or I mean, you can't go. If you're unable to get inside, that is also another hazard, because trying to get you in and out, what happens if you fall down? That family member is hurt. Um, if you are able to drive or get someone to take you, that would be the best way to go. But we will have to find ways to make it work. But if you are physically unable to step up into a medic unit and get in and out safely, that would be also an obstacle if we can take your family member or not. And think of it this way: once we get to the hospital, we have to get that family member out first and then get the patient out. So now we're delaying care to the patient because we're trying to get the family member out of the ambulance, because it's such a big step up and you have to literally climb in and climb out, the best way to put it. If you need us, of course, we're there for you. But we just hope that you don't have to call us. But this is a different equipment that we have. So I mentioned that we have duty officers. They come in this SUV here. We have different type of. We have an engine, and we have a truck, and we have the ambulances. These are the people that we have that will come and help you. And everyone on all these pieces of equipment are certified to help. And do we have any questions? That is it.
I have several questions.
Okay.
Okay. Some are real quick answers and others may be a little longer.
Okay.
On the on the slide where you had the things that you should have with you, you had a flashlight. So why is that something we should keep next to us?
Ma'am, I will admit
There you go, right
I,
there.
I saw the flashlight and was thinking the same thing because I have no idea. What is
Okay,
I I'm not sure.
okay,
I Maybe if you don't have a light outside your house, you might want to like to come back in. I'm not sure.
okay,
I live
okay,
in country Darkville. Okay. So even though I have a light by my door, getting to and from my car, it's pretty dark. So I don't know. I always have a flashlight just because I think that's for some country folk, some more of those
Okay.
rural folk. I don't know.
And that could be it too. So, because we have calls sometimes where we will turn on our scene lights to light up the area for us because it's so dark. So I that's the only thing I can think of, but
okay, that's cool. Um, so did I understand you that at Sparrow's Point, where I have some important people, um, that there's no ambulance service there?
yes, ma'am. But the good thing is Station 9 is literally up the street from 57. It's not even a 3-minute drive. And Station 9 has an ambulance.
Okay, so areas that don't have an ambulance from another area would come. Is that what you're saying?
Yes,
Okay,
ma'am. So
okay,
yeah, so Station 9 covers 57's area because they don't have a medic unit out of there. So 9 covers that.
okay.
Mm-hmm.
The most form.
Mm-hmm.
My fleet of doctors has never offered me such a thing. Did you say, I mean, is there some way to download that form, or can I only get it just by um, bugging bugging some doctor?
You can go to www.marylandmost.org and you should be able to download it from there. But
Okay,
if not, yes, when you go to your doctor, you can ask them to go over the most form and you want to get
okay,
one filled out.
okay. Um, Somebody once upon a time told me that an ambulance in Baltimore County couldn't go outside of Baltimore County. But on your charts, you list Hopkins and Mercy. So
Mm-hmm.
is there something that would keep an ambulance from going from Towson to Hopkins? And the reason would be because your doctor is at Hopkins.
So, if you think about it, there's only 4 hospitals inside of Baltimore County's jurisdiction. Everything else is Baltimore City. And again, for me, I am stationed at Station 4 in Catonsville. And my first through hospital is St. Agnes, which is in the city. And I go to St. Agnes all the time. So no, that is not true that Baltimore County cannot go outside of Baltimore County. We
Okay.
can. So you if your doctor is at Hopkins and you are stable enough to make it to Hopkins, we can attempt to get you there. But if you're in Towson and you are unstable, unfortunately, we have to take you to the closest hospital
Right,
because
I understand
we
that.
got to
Yeah.
get you somewhere to get you
That's what I would
stabilized.
want you to do
Yes. The
for
good thing
that.
about Hopkins is that they do have their own transport unit. So if the closest hospital contacts Hopkins and they can get you transferred to there, they have critical care units, they can come and get you and transfer you to Hopkins.
Okay.
But if you're stable enough to make it, yes, we can take you there. And also Hopkins is a specialty unit.
Okay.
So like John Hopkins is our pediatric center for Maryland. So if we have any really sick kids, if we can bypass safely to go to there, we will go there. But Hopkins is a specialty center for a lot of different things. So we would definitely go there. Like University is a specialty hospital for a lot of things. So we go there for stuff. That's also where the trauma center is. So we will take you where the specialty is that you need. If it's in Baltimore City, we'll take you to Baltimore City. We will take you to where we hope you can get the best treatment for whatever it is you're going through.
Right. Okay. Um, so once upon a time, I asked a fireman friend of mine, suppose nobody can come to the door and let you in. And I'm going to add at this point, and there's no special number you can tell anybody to punch in to open a door, no key outside. My friend said, "Oh, we'll get in." So what does that mean? If you've called 911, now you've fainted away. The your people come to my door, maybe even both doors, but I can't let them in because I'm fainted away. So what do you do in that situation? Which I hope is not just say, okay, we couldn't get in, next job.
Um, they would have to break the door in.
Okay.
So they would it's called forced entry, and
Mm-hmm.
they would find a way to force their way in through the door to get to you to give you the
Okay.
treatment that you need.
Okay.
Hmm.
So I found this out from personal experience.
Uh-huh.
Memorial Day a year ago, I was in incredible pain, and I was taken from my bedroom on the third floor into an ambulance, and we made our way to St. Joe's.
Hmm.
And I said to and so I'm in terrible pain. Every bump is, I recall lying on the, in the ambulance, and like every bump I'd say, pain. And I said to whoever was attending to me, don't you have shock absorbers? And she said, oh, no, we don't have those. So when is Baltimore County going to put shock absorbers in these emergency vehicles? Or at least the ones that don't have them?
Um, that 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 is a really, really good question. Um, the thing about it is, um, there's a lot of wear and tear on these medic units. And sometimes when we have what we call frontline medic units, so those are the main ones that are at the station all the time. If they have to go out because something broke down, or if they have to go out of service just for maintenance, you get what we call the reserve. The reserve medic units are the ones that are a lot older. So those really ride really rough. Don't know if that's one of the ones you were in. Some of the newer ones have a better ride. It just all depends on the wear and tear. But sometimes, we can try to avoid the bumps. Sometimes they're hard to avoid, but uh, this is the luck of the draw. It all depends on what medic unit you're. If you're in an older one, a newer one, but they're supposed to come with shock absorbs on them. But that could be something that you can follow up with your representative in your neighborhood. I guess I
Okay. So Janelle, that's my last question. Thank you very much. You were very informative. So
oh,
thank you.
thank you, thank you.
And I really appreciate you dispelling the myth that just because I go 911 AMBO, that I can go in front of the line. As someone who's been sitting in some ER rooms and being in triage, there's a lot of angry folks who are coming in by AMBO saying, why didn't I get pushed front of the line? So thank you for that reassurance that we are being triaged and, that you are there. And we just are grateful for your time, Janelle. So we appreciate you.
Oh, thank you, thank you, thank you for having me. Um, but yeah, that is the big thing lately. A lot of people really don't understand that. So,
Well, and if we could take some of the frustration that maybe your team absorbs from very sick folks who are just desperate for their own care. I mean, I think it's
mhm.
worth saying again, and that's why I lifted that up. But hopefully when people watch this video, whether it's in real time or in review, they can go and really see some of these resources that we have that if you find yourself calling 911, what to expect, and how to make it a little bit more transition friendly. So thank you,
Yeah,
Janelle. Have a
you're
great
welcome.
day. We appreciate you. Have a good day.
You too. Thank you.
Bye.
Bye bye.